What I want for my patients is to feel safe, to be in a mindset where they can think to themselves, it's okay now, we've got a plan. I'm Dr. Zsolt Zador. I'm one of the neurosurgeons specializing in cranial neurosurgery as well as spine surgery at the Kansas Spine and Specialty Hospital. Having a father who is a scientist, it installed that curiosity in me from an early age, and that's what was part of the drive that took me towards medicine. I was born in Szeged. That's a town in the southern part of Hungary. Us as a young family, we were fortunate enough to live in places like the US and the United Kingdom. And during this journey, I met a lot of personalities that inspired me. All or most of them happened to be doctors. And that's what these role models directed me towards pursuing medicine. First, I was fortunate to be trained in the United Kingdom by a lot of good teachers, a lot of good trainers, and that introduced me to cranial surgery as well as spine surgery. I was gravitated towards cranial surgery because of the complexity and also the impact that we can make on patients' lives. I saw a patient as a medical student who had excruciating pain in one side of the face because of a tumor pressing on the nerve at the base of the skull. And an operation took that tumor away, and the patient was reborn. And it was that snapshot that drove me down this path. So more than half the patients that I see have been diagnosed with a brain tumor. Now, some of these brain tumors are actually found by accident. They just sit there, they don't do anything. We don't need to do anything. But we will tell you that some of them will need surgery, and that's when our job begins. It starts with a consultation where you will be seen and educated on the problem that we're facing, and we'll put a plan in place together, and we will walk through with you through this journey and support you all the way. What gravitated me to this team was the immediate radiant energy, the positivity, to work together to make things smooth, good, and help patients through their healing journey. That's what brought me here. It's a very robust system with multiple teams of people helping us stay in touch with our patients, making sure that every aspect of their care is taken care of and followed through. You oftentimes hear, don't let your job be your identity, but to me, neurosurgery has become such a special thing. That experience has become part of my identity to an extent. Having children was one of the other transformative experiences, and we have a lot of fun as a family. We have two very lively and very smart boys with my wife, and as a family we enjoy the outdoors, and fortunately Kansas has a lot of that. When we embark upon the patient-doctor journey, it's not just the patient and the doctor, it's actually a patient and the family and their family unit that we are helping. And we give the opportunity for them to engage and to ask questions and to share their worries with us. It's a life-changing experience, and that gets the patient into a very unique, difficult space. I wanted to be that person who gives back as much control over their life as possible.